Welcome back. Right now, with school starting, many families, parents, and kids are worried about allergies, especially severe allergies, as their kids head back to school. I recently spoke with an expert all about what you can do to make sure that your child is safe and ready wherever they are, just in case they have the unexpected and the unwanted, which is anaphylactic shock. Let's take a look.
After a year of remote learning, children will be returning to in-person classes this fall. On average, 2 students per classroom have food allergies, so additional planning and preparation is necessary to prepare the classrooms. Here with advice on what families, students, and school staff can do to prepare for the upcoming school year and ensure that children with life-threatening allergies are kept safe at school is Kelly Barlow, registered nurse and spokesperson for Kaleo. Good morning, Kelly.
Good morning.
What are you doing to prepare for the return of students in school this fall, given this evolving school environment?
Yeah, so school districts have done a really great job of implementing new safety protocols and mitigation strategies during the COVID-19 pandemic. And now we really need to focus on bringing students back into the classroom, but also those students that have life-threatening food allergies. So some of the things that we're strongly encouraging families to do that have students with life-threatening food allergies is to make sure that they're going into their physician's office and renewing their epinephrine autoinjector prescriptions, but then also ensuring that their emergency anaphylaxis care plan is also up to date.
Roughly 25% of U.S. schools do not have a school nurse. What can parents and children with life-threatening allergies do to help make sure the school is prepared in case of an allergic emergency?
Yeah, so because so many schools don't have a school nurse, it's really important that families connect with their schools to find out who manages those life-threatening food allergies during the school day. And once they connect with who that individual is, that's the person that they're going to want to make sure has a copy of that anaphylaxis care plan and also knows what type of epinephrine autoinjector they have, and then also where it's stored.
What should parents of children with life-threatening allergies consider when preparing to send their kids back to school?
So it's really important to talk with the physician about what type of epinephrine autoinjector is right for that student and that family. And there's a really great product called AviQ, and it is an epinephrine autoinjector that has a voice instruction system, so that once the individual opens it up, it begins to talk them through the injection process. It takes a lot of the guessing out of it. And then it's also created for the untrained user so that it's really convenient to use in places like a school where a nurse won't be.
What treatment options are available if a child has an allergic emergency in school?
Yeah, so like I said, there's a lot of different types of epinephrine autoinjectors out there, and it's really important to discuss what type of epinephrine autoinjector is best for that family with their physician.
And what's the most common food allergies among school-age children right now?
So a lot of people do know that about the peanut and tree nut food allergies, but some of the other more common ones that may not be well known would be cow's milk, eggs, wheat, soy, fish, and shellfish are just some of the top ones.
And in the U.S., up to 1 in 4 children have their first food allergy reaction at school. What are the signs and symptoms of an allergic reaction?
So that's where that anaphylaxis care plan is going to be really important, because it not only tells the individual what type of food allergy this child has, but then also what kind of reaction they may experience. Reactions could be as mild as maybe just an upset stomach. It could be a little bit more severe where they're experiencing maybe an all over body rash with those raised hives. And then also it could be very severe, like the anaphylaxis reaction where that airway even starts to close. And that's where that epinephrine autoinjector is going to be really important.
It is really important to have that. So where can we go for more information about AviQ?
You can go to aviq.com for more information about that, and they have some templates of those emergency anaphylaxis care plans, or you can talk with your physician.
Really important life-saving information as we head back to school to help children with allergies and families feel safe and prepared for an emergency. Thank you so much, Kelly Barlow, for joining us today with this important information.
Yeah, thank you so much for having me.